Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians of the DNA Company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is within your control. This does not substitute the medical advice given by your personal doctor, therapist, or other healthcare professionals.
Bonjour, everyone. My name is Dr. Krista Kosterman. I am the Chief Science Officer here at the DNA Company, and I have the absolute privilege and pleasure of being with you this evening. Allow me the privilege and pleasure of introducing Dr. Adelia Sapp. She is a naturopathic doctor and someone very topical to tonight, has a lot of additional training and expertise in the space of dementia and Alzheimer's. So we don't need to hear me ramble about her. Dr. Sapp, I wonder if you could give us a moment just to introduce yourselves to our audience, especially speak a little bit to your history with the DNA Company and then your training in Alzheimer's and dementia.
Hi, Dr. Kosterman and Dr. Warden. It's a pleasure to be here. I'm a former employee of the DNA Company. So I was working for you guys when you were just a tiny little startup in Mississauga, making supplements by hand in the back, working with Dr. Mansour, who I got a lot of good training with. I'm a naturopathic doctor trained in Toronto, Canada. I ended up moving to the States a couple of years ago to work for a health institute that had a focus on cognitive health. So worked with a lot of burnt out executives, many of whom had some mild form of cognitive decline. So cognitive decline, is a spectrum, and Alzheimer's is a form of dementia, which is an umbrella term. So there's a lot in there. There's ADHD, there's autism spectrum, there's symptoms of dementia, and those all fall in the realm of cognitive health. So in my practice, I focus a lot on cognitive health as well as mental health. And I love studying genetics ongoing and their relationship to mental and cognitive health and Alzheimer's in this case.
Yeah, well, we're so very grateful to have you and your practice and your curiosity back with us, in particular this evening, where we want to dive in with yourself, Dr. Varda, and myself into the very murky, confusing, fearful topic even of Alzheimer's and separately of dementia. Yeah, so I wonder, Dr. Varden, in preparation for this, you brought forward a very interesting and recent publication from Nature in regards to a GWAS study. So a study that effectively looks at a whole bunch of different genes and understands from there. I wonder if you want to offer our audience a little bit of an update as to what this paper looked at and at a high level what some of those findings were.
Actually, this publication just was published in Nature Scientific Reports, and it was called Microvascular and Cellular Dysfunctions in Alzheimer's Disease, an Integrative Analysis Perspective. And I know that can be a lot of words there, but really what the study was looking at is it was trying to understand what might be the cause of Alzheimer's disease. And of course, all of you know, and why you're here, this is a condition that leads to memory loss and thinking problems. So the scientists really focused on how tiny blood vessels in the brain and the cells around them, as well as the material that supports the brain cells called the extracellular matrix, might be involved. And what they found is that the blood-brain barrier, which acts like that protective shield that prevents harmful substances from getting in the brain, it found that damage to that barrier might happen early in Alzheimer's disease. And, of course, the cells and the extracellular matrix area can be harmed due to substances that can enter and pass through that blood-brain barrier, worsening the disease. And they also found like the extracellular matrix. This is that network that provides structure and support for the brain cells. And in Alzheimer's, there are changes and damage to that material that can affect how the brain cells communicate and function. Also, the cells, specifically oligodendrocytes, these are special cells in the brain that help protect nerve fibers by forming a coating around them, like insulation on electrical wires. And the study found that these cells don't work properly in Alzheimer's, and that can cause damage to the brain's wiring, affecting memory and thinking. And there's other pathways that they were looking at. A particular pathway that is an insulin signaling pathway can be important. And, when there are issues with this insulin signaling pathway, which I'm sure some of you have heard us talk about before, that Alzheimer's is actually now tend to be known as type 3 diabetes. When we talk about sugar, blood sugar regulation, insulin regulation, mitochondrial health, the life of the body, the energy, the milieu, the terrain of our bodies, our brains, these are all very important. And they focused on the part of the brain called the hippocampus. And this is very important for memory. And it definitely seems to be more affected by Alzheimer's than other areas of the brain. So it was really interesting that looking at these different aspects, things that we look at, that it's not usually just one thing, that it is affected by many different things. And when we have an idea about what the cause or what, worsens the problem, then we have ideas on how can we prevent that? How can we kind of backpedal and maybe even fix it some, but definitely, what we can do. Overall, that study suggested that problems with blood vessels, supporting materials, and definitely the brain cells all can play an important role, in Alzheimer's disease.
Thank you for that.
Awesome. Thank you, Dr. Martin. Yeah, super cutting edge, as you said.
Yeah. And so,
Yep.
Dr. Sapp, I wonder, with this awareness, with some of your very specific training, how are you, approaching your working definition of what these conditions are, kind of the general term of dementia, and more specifically Alzheimer's, and to an extent how they're being caused? Because if what I heard from Dr. Varden correctly was effectively there's a whole bunch of little things that will lead to this.
Yeah. So dementia is an umbrella term, and Alzheimer's is the most common form of dementia, but typically it is a progression and it is a spectrum. So before people have, full-blown Alzheimer's, it's usually decades in the making. So it's definitely something that people can work preventively. And if there's anything I want people to take away from this podcast, it's that the vast majority is not genetic. However, genetic testing will really help you to target certain weaker factors that you might have. You, Chris, would probably agree that this whole concept of good genes, it's not really a thing because everybody has weaker areas. And given that dementia and Alzheimer's are so multifactorial, we kind of want to know what those areas are ahead of time and arm ourselves ahead of time to work preventively. So it's really only a minority of cases that are strictly genetic. In most cases, we have genetic factors that are better to know about in advance, and we can work preventively. So, yeah.
And when you consider that Alzheimer's, dementia, these are diseases decades in the making.
Yeah.
So it's never too early to start with prevention.
Agreed. Yeah.
Yeah. And what would you capture in your prevention? Where would you spend your focus? So I want to acknowledge, I can already predict the answer from you both is, well, get your DNA done and figure out what your weak points are, and we should go on from there. So I wonder if we could maybe do a quick review of, common weak points, and maybe we can even touch on some of the genes associated with those common weak points. So especially a lot of our audience, I don't think we asked the question, a lot of our audience though tends to walk into this with their 360 in hand. And so I wonder if we can speak to some of the sections that can be weak and then some of the genes associated with that.
Absolutely. Yeah, so the gene that's most known is ApoE. So that's the one where people are super scared and they say, "Oh, do I have the Alzheimer's gene?" And there's a number of different variations of ApoE. If you have one copy of ApoE4, it increases your risk of Alzheimer's significantly if you don't modify all the factors, which are diet, reducing stress, improving sleep, and we can get more into them after. And then if you have two copies, it increases your risk even more significantly if you don't work preventively. And this being said, there are parts of the globe and studies on remote areas where people have even ApoE44, which is considered the most high risk one, where people are reported to not have any cases of Alzheimer's. So that just speaks to how much the environment plays a part. But if you have those genes, you know how much more aggressively you want to pursue prevention.
Mhm.
So let's say you got a really good report when it comes to Alzheimer's. Like let's say your TCF7L2 is optimal, your ApoE is optimal, your BDNF is optimal, your detox genes are optimal. You might, not pursue prevention as aggressively, particularly if you have no signs. But if you have an ApoE44 and you find that out when you're in your 40s or 50s, you've got plenty of time to work preventively and completely change your outcome. So I don't know if I answered your question, but
I think it's a great start. And before I toss it to Dr. Varden, maybe to explain some of those genes for the people in the back, I want to just reiterate what she said, because I think this is one of the most important points she made. Even if you have ApoE4, that is not fatalistic, that is not deterministic of you having Alzheimer's. There are people in this world that carry that variant, even the 4-4 variant. They have been studied and they do not have Alzheimer's dementia. It is not fatalistic. And what Dr. Sapp has talked about in regards to, blood sugar management, what Dr. Laura is talking about, the decades of in the making, this is kind of where we need to be focusing, especially should you have that very terrifying for many people ApoE4.
yeah. And I think it's good for people to know that there isn't just one, there isn't a Alzheimer's gene, like you said, that's fatalistic. There's a very small minority of cases, and I don't know the exact percentage, but well under 5%, let's say, that are early onset, that are strictly genetic. But for the vast majority, that's not a concern. So
And early onset, what I believe that is before 60.
yeah, it's actually between 30 and 60. So it could be a really big range.
Okay.
And yeah, it would be more like you'd have to go see a clinical geneticist and get a referral. And yeah,
Yeah.
it's not common.
Got it. Okay. So Dr. Varden, I wonder if you want to dig a little bit. So, you kind of introduced dementia as type 3 diabetes, and Dr. Adelia or Dr. Sapp also kind of mentioned a few genes that are associated with that. I wonder if you want to dig in a little bit deeper there.
Sure. Well, I mean, when you're talking about blood sugar regulation, okay, there's a lot of factors at play. So, a couple that Dr. Sapp already mentioned is the TCF7L2 gene. This really works into your insulin response. And that you'll find if you have your DNA 360 reports, you'll find in your diet and nutrition report. That's one of the main places you can find that. I mean, we do have it sprinkled throughout, but another one would be dealing with how you break down starches, and how that's going to affect blood sugar, because obviously carbohydrates, which starches are part of, don't forget, carbohydrates also include fruits and vegetables, okay? But specifically starches is the AMY1 gene, AMY1. And again, you'll find this in your diet and nutrition report, because this really speaks into starch metabolism and, how well do you break that down? Also your ApoA2, so that you've got your ApoE, okay, which Dr. Sapp spoke into, but then ApoA2, which can oftentimes be associated with fat gain to fat consumption. But you start looking at all of these as players on a team they all play a part. They play a part in how you metabolize the fat, how you metabolize these carbohydrates. How does your insulin respond to this and, work to get the glucose into the cells, which works into another gene that you'll find in your diet nutrition report, and that is your SLC30A, 8, the number 8. And this works for zinc transport in relation to what happens in the pancreas with creation of insulin. And how well is that working for you? Is this something where, you don't do that very well and you may need to supplement with zinc? But again, we are looking at more players on the team that start to build the larger picture of any susceptibility that you need to be aware of to address for prevention of being in that percentage that could possibly get Alzheimer's. But again, I want to reiterate, and I know we've already said this a few times, just because you may have a particular variant of any one of those genes, it does not mean that you will get Alzheimer's or that you will get dementia. This is why you are getting and the knowledge, why you are getting your DNA 360 reports done. So that way, your blueprint, you have your map, what you should be doing to be in that percentage that doesn't get the disease.
Yeah. Which is, I love that point brung home again. It's so important, and it's something I think we'll have to keep echoing. Yeah.
Yeah.
Oh, please. I don't want to interrupt.
You
Please
start.
Well, I was going to transition us into, because I think Dr. Varden there really captured kind of the diabetes type 3 element of it. And I wonder, especially given cognitive health and brain function is such a focus of yours, if you could dig into some of the other genes that you mentioned, in particular BDNF, and how that plays into it all.
Yeah, so Dr. Bredesen and the Apollo Institute kind of break down Alzheimer's into 6 types, and the DNA company with all your reports have genes that relate to each of those types. So one of them is inflammatory, and your methylation genes are relevant and well studied to be a factor in Alzheimer's. So the MTHFR SNPs, we always hear about them. There's a specific SNP that we hear about. It's this C677T, I believe, and Krista, correct me if there was a number off there, but there's one main SNP that's always quoted, but really it's not just that one main SNP. There's a whole bunch of methylation genes. We have at least 6, or used to have 6. 7 now. And you want to look at overall some of the most well-studied methylation genes. How is your methylation, which is essentially on a practical level ends up equating to your ability to quench inflammation in the body. So it affects your intake and absorption of B vitamins, and inflammatory is one of the more common forms of dementia. So you want to look at your methylation genes. Those are relevant to that subtype, and they are contained within your reports. And you want to look at overall, is that a weaker section? And of course, some of the recommendations. So taking particular forms of B vitamins, and the devil's in the details with this one, because the methylated forms are not optimal for everyone. As me and Dr. Krista know, or Dr. Kosterman firsthand.
Yeah.
So yeah, check out your methylation genes. The first one, even before that, would be your ApoE, of course. You want to know what your risk is with that one. And then the second type is glycotoxic. So that relates to exactly what Dr. Varden was talking about in terms of glucose and its ability to affect cognitive function and reduce cognitive function over time. So it is a huge factor, even based on what I've seen in early cognitive decline and mild cognitive decline. People's cognitive function tends to get better even with just dietary changes if they're able, which sometimes requires a lot of support, but that is a big factor, and you can get more information on that through your report. And your insulin resistance and genes like TCF7L2 have been well studied and correlated with Alzheimer's. The combination of ApoE suboptimal and TCF7L2 is particularly important. So let's say you had a suboptimal version of both, you'd want to work more aggressively on prevention.
To confirm something you just said, though, so in your clinical practice, for people exhibiting mild cognitive decline, and
Yeah.
we'll support the audience in a little bit with what that means exactly and how you can test for it. But for those people, especially I'm thinking to people who are here for information, or those who are caregivers and know someone, right?
Yeah.
A diet change will have meaningful impact, namely a diet change that reduces a diet that is already relatively high in sugars. Is that a true statement?
Yes, yeah, especially added sugars and refined carbohydrates coupled with lower protein. If someone is able to make dietary changes where they're kind of managing those factors, there typically will be changes in the course of months. The thing is, it's not instant, and it really takes sometimes doing a retest to see, how it's affecting. So you can redo the MOCA. I believe the minimum period of time is 3 months. By 3 months, most people will forget involved in the test, but that's one way to see whether it's working.
So a little bit of a tangent, because I know you're going to kind of jump into a different thought train. I wonder, Dr. Varden, if you want to speak briefly to what the MOCA is, because I think this lends to, those that are seeking to prevent. This is one way you can engage with your doctor to the ends of screening for and preventing, or at least getting on top of it should anything become worrisome in the results.
So the MOCA test, actually, it's MOCA. It stands for Montreal Cognitive Assessment. And there are several different kinds of tests. This is a more comprehensive test. It is administered by a medical professional, your doctor, and this includes tasks that evaluate executive functions, memory, language, visuospatial skills. So yeah, this is probably one of the more recognized and more commonly used tests, but there are others. And I do want to definitely stress that anytime that anyone is thinking, they may have Alzheimer's or someone, allow the doctor to be the diagnoser. They are the ones who need to administer these tests. And any type of tests like the MOCA. Okay. I mean, there's other ones like the mini mental state evaluation and, other types, but these tests are often used in combination with a medical history, physical exams, other diagnostic tools like brain imaging, blood tests. All of these are taken into account together to diagnose Alzheimer's. Okay, so it doesn't work off of just, a questionnaire or a particular test. So, this is something you jump into on your own.
I like the humanization of it, right? So I'll offer a patient I have in my practice family history of Alzheimer's. And so there's a sincere concern, right? And they're working very proactively, but there's this kind of gnawing stress at the back of the head. And I'd say once a year they come in, they're like, I think I have it finally. Can you do the test? So I'll run the test and it'll come back fine, like no change from the year prior. And then we'll have a conversation. We'll ask questions around like, why do you think this? And often it's like, I'm losing my memory. I'm forgetting things and this and that. And oftentimes that's more situational stresses that will cause that, right? And so I say this to the end of, yes, you have to be vigilant, but there's a beautiful care, I think, when you approach your provider with the concern and they have that medical history that they can compare against, as well as they can also find other reasons for kind of some of the memory slipping that are not the big A or the big D that we all start getting concerned about. So I really like, Dr. Laura, your idea of having tests and working with the provider to sincerely assess that, as opposed to fearing the worst, right? It's not often you get to a doctor and they'll be like, nope, you're actually good. Yeah. So jumping back into some of the genes and some of the more cognitive facing genes, Dr. Sapp, Where did we cut you off? Where would you like to jump back into it?
No problem. Yeah, I just wanted to also highlight what Dr. Barton was saying, just in that it can be frightening, as we've talked about. A lot of people are really concerned about this particular illness. And just like as a first step, if you're 45 or older, getting your genes tested, particularly ApoE, would be a first step. And talking to your primary care provider about administering a MOCA, because it is a 10-minute very well validated screener. So either they will just perform it in office or they can refer you out to another healthcare practitioner. It's not something you can self-administer. And it definitely has to be conducted in a particular way for accuracy, because there's a lot of potential there when it comes to memory for sort of subjective views that might not be accurate on one's own cognitive state. So, yeah. But yeah, back to the genes. So another subtype of Alzheimer's was toxic. So the genes that would be relevant and that are well studied would be GSTM1 and GSTP1 as two of the main detox genes that have been associated with Alzheimer's. So basically, when we've looked at those remote studies we referenced about parts of the world without any cases, despite genetics, they typically were rural areas where people didn't have as many environmental exposures. So it's a combination of us all living in a modern environment with lots of toxic exposures. And then when you have those suboptimal genes, you essentially have to work extra hard on processing the toxins in your environment. And those can be glyphosates, benzenes, medications, alcohol, air pollution. It all kind of adds up. Some of the things you can do to improve detox, one of them is infrared sauna, and that's been shown to help cognitive health. It's even a very minor factor in Alzheimer's prevention. And then there's, of course, detox supplements that you can find more about through a DNA co-report, but there's milk thistle, there's NAC, there's different ones that help mitochondrial health as well. But basically lowering your toxic burden. The Environmental Working Group is a great resource for that. They have the whole Dirty Dozen, which is the most pesticided crops of the year, and Clean 15, the least pesticided crops. So you can make things more economical for yourself. But basically, detox and the genes GSTM1 and GSTP1 are studied and relevant in that particular factor of Alzheimer's. So, yeah.
Yeah. Yeah, so for people with their 360 who are frantically figuring that out, that's in the inflammation section. And then this is the GSTP1 as in Peter 1, and then GSTM1 as in Michael 1. Yeah.
And mold, actually, I'm just throwing that in there because that is something that we're seeing more and more of. In terms of why that is, there's a lot of theories out there. I suspect climate change. That's one of the proposed theories out there, but mold toxicity is becoming more and more of an issue. So for people who may have had exposure to mold for long periods of time, who may have colonization, taking care of that would be a factor, particularly if you have suboptimal detox genes. So
yeah.
it works into and makes you realize what I said before, that it's not just one thing. Like Dr. Sapp and Dr. Kosterman have said, there is so much more going on that the genetics in themselves, that's not the fatalistic thing. What you really need to look at is your life, the food you're putting in your mouth, the toxins you are being exposed to, the sleep that you are getting. Sleep. Yes.
Our favorite topic here.
Yes. One of my favorite topics outside of poop. You need to be eliminating, the toxins that your body is trying to clear. But sleep is amazingly important. It truly is one of the absolute foundations for good health. And actually, Dr. Matthew Walker, in his book, Why We Sleep, talks about this and talks about Alzheimer's and the studies that have been done that when we sleep, especially during deep sleep, this is when our glymphatic system, different than our lymphatic system. Lymphatics is like neck down. Glymphatics is in the brain. And this is where the glial cells will actually shrink up to 60% of their size and allow almost like a dishwashing effect in the brain to clear, these protein plaques and other particulates and toxins and be able to just wash them right away. This happens during deep sleep. And this is what they have tested. They have tested that in the cerebrospinal fluid at how well, how long, how much deep sleep someone is getting and how many of these proteins and other toxins are being flushed away. This is one of the reasons why it's so important that you are sleeping. Again, three main things that I ask my clients. Are you sleeping? Are you pooping? And is your blood sugar regulated? Those three things foundationally affect your predisposition or risk possibly getting Alzheimer's or dementia.
Yeah, that's a really good summary, Dr. Martin. And if I could just continue on that, other than some of the concrete steps on looking at your risk, let's say once you're 45, that is the recommendation from the Apollo Institute, which is cutting edge institute in Alzheimer's prevention and treatment. But other than that, let's say you just want to start today with a couple of things that will reduce your risk. An anti-inflammatory, low glycemic diet, so less added sugars, less refined grains, more proteins and vegetables, essentially. That is a top factor. Getting enough sleep as much as you can without stressing yourself out about sleeping more is a big factor.
You can tell she's worked in a high power executive clinic when she's like, get more sleep, but don't stress yourself.
Yeah. Very true. But over the years, like even starting in my internship, as an approximation, I'd say maybe 8 in 10 people I've seen have some degree of sleep issues. And most of those people think it's just them, which I find, upsetting, troubling, just in the fact that most people can improve their sleep over time, and just knowing that insomnia is not a static thing per se. We can all improve our sleep over time. And then another is exercise. I mean, most people know it's kind of a magic bullet. We don't want to overexert ourselves either. And that all depends on your particular constitution. But cardiovascular exercise, stress reducing exercises, walking, that's all part of an Alzheimer's prevention protocol. Sleep, diet, and then of course stress is huge, right? We want to have a little bit of stress, like a little bit of cortisol. We want to have a cortisol response, but we don't want to have too much stress. So it's a happy medium, but most people are kind of in the point of diminishing returns once they hit a certain age in our culture. So keeping that in mind, we want to work on stress.
Yeah, which the tricky of that too, I find people who aren't stressing have more stress, and people who have more stress aren't sleeping, and it's this happy chicken and egg that feeds one another.
Yeah. Although we are getting more and more kind of resources out there, like books like Matthew Walker, like a lot of this stuff is fortunately making it out into the mainstream. So, using a growth mindset, like I think it's good to acknowledge that they can all be worked on without overstressing ourselves about it. So,
yeah, and even following these leaders in the field, like Dr. Dale Bredesen, and his last name is Bredesen. So if you want to look him up, he's got some great information. He's done interviews and other, trying to think, I think he did a TEDx.
Yeah, he did.
That sounds right.
Yeah. So, I mean, just look up his name. Fantastic information. Another leader in the field of brain health, Dr. Daniel Amen.
Yes.
Fabulous researchers and doctors, always having some great information. And, there's also Jim Quick, who does a lot with, brain health and keeping your brain strong and active. And that's very important as well. We don't want to become complacent. We need to work those brain cells. What wires together, and this helps to increase BDNF, that brain-derived neurotrophic factor, which is also one of the genes that we look at that you'll find in your mood and behavior report, because this really works in that neuroplasticity and the growth of the neurons, for brain health. So definitely something to be looking into.
And so I wonder, I think that's a point with which we can start to conclude our evening and offer, or at least I'm going to start with my incredible gratitude and praise of you both. Thank you so very much for joining us this evening and offering both your experience and your expertise and the care and compassion behind this, because I know our audience is kind of, some are here for prevention and some are here witnessing this in another, and the fear of, what about me, or how do I stop it? So thank you for so masterfully offering to our time tonight. We're so very grateful to you both. And thank you to the audience who's been here and offered the questions and the care and the concern, especially for the caregivers out there who are supporting someone and watching someone go through this. We're very grateful for you, and we hope we've offered some things to the end of things you can do to prevent, as well as better some of the outcomes in the people that you're working with. Yeah, so ladies, thank you very, very, very much. I'm so grateful for the time, thought, and energy you've offered us this evening. And I think that's where we wish our audience adieu and au revoir and all the other niceties.